St. Jude Global, Sanofi Espoir Foundation, University Hospital of Antwerp, Uganda Child Cancer Foundation, Uganda AIDS Commission, and others who have made this day possible. I also want to thank in a very special way the local organizing committee that has been composed of people from Uganda Cancer Institute, as well as our sister institutions and our civil society partners that have worked tirelessly to deliver this event successfully to all of us. Last but not least, I want to recognize the Department of Pediatrics at Uganda Cancer Institute, who have taken the slack while more than half of our members have been involved in preparing this Congress for more than 8 months. I want to thank you very much. So I want to conclude by saying that no child should die of cancer. Cure for more and care for all. Thank you.
Ladies and gentlemen, Dr. Joyce Balagade, President of SIOP Africa. Round of applause as she takes her seat. Thank you very much, Dr. Joyce. So, in African culture, it's always good to not speak to strangers. So, I think it's my great pleasure, ladies and gentlemen, to also signal the arrival of the Director General Health Services from the Ministry of Health here in Uganda, Dr. Henry Mebesa. Let's give him a big round of applause. Thank you very much. Up next, it's my great pleasure, ladies and gentlemen, to have the honor of introducing the SIOP President International. Please welcome Professor Catherine Pritchard as she makes her way to the stage.
Thank you, and I want to offer my huge congratulations to Joyce and her team here and the colleagues at the Uganda Cancer Institute and all those stakeholders in the local organising committee who've made this Congress possible. It is a huge achievement that we are here, and I could already feel all that energy in the coffee tent outside where with the dancing, the wonderful Ugandan hospitable welcome, and the most important thing is we're all talking to each other, sharing our thoughts about the session we heard first at the opening around the Global Initiative for Childhood Cancer. And I'm sure we're going to make great progress today, and you'll all learn a lot over the next couple of days. When I go to many I have been in the past at least to many meetings around the world, but certainly over the last 2 years, many on Zoom, which have been focusing on the regional needs for improving childhood cancer services and survival around the world. And that map of the world that's frequently shown, and whether it's looking at things like survival rates, presence of cancer registration to cover the population, the continent of Africa nearly always has lots of red in it. So it might look like, a really big mountain to climb. But on the other hand, and I think we heard it in the opening session this morning on the GICC, that it's a mountain that we can climb together. And it's step by step. And we've seen some of the tools about how to go about engaging the people in your country that can help you realize the potential for curing children with cancer in your country, the resources and the skills, what it needs to make it happen, and to mobilize the supporters and stakeholders that you'll need to do that. And we heard very powerfully from Professor Leila Hessison about what she's done in Morocco, but in her past role as the previous SIOP Africa president, she's really championed the importance of personal leadership. And it's the people that are going to make this happen, not the bricks and mortar. Of course, you need good infrastructure in which to receive and treat your patients, but without good teams, and that's doctors, nurses, the pharmacists, all the healthcare professionals, and civil society, and the support of your ministries of health, and many others, and I won't repeat the long list of people to thank that Joyce mentioned, but we've seen the road ahead of us mapped out. The Cure-All framework that's been co-developed by many people in this room, the WHO cancer team, the huge support from the St. Jude Global Programme and many others, that road is mapped out. We kind of know what we need to do, and really now it's the implementation challenge to how to get there. And I think the title of this Congress today, Innovate for Africa. You know, as a continent, I think Africa has always been very innovative. There are many practices that have been born of necessity in Africa, which have been shown to be successful. And I think that by working together, climbing that mountain step by step, building on the work of others so we don't have to repeat things unnecessarily, we will get to that goal of achieving higher survival rates across the whole continent, and I'm sure many, many countries here are capable of going well beyond the 60% and others being well on that road. So to the Honourable Health Ministry of Uganda represented here, Dr. Jackson Oram from the Uganda Cancer Institute, and most of all Joyce and her colleagues, I want to congratulate you on the already the obvious success of this Congress. The presence of so many people here are going to make things happen for children in Africa, the presence of civil society partners, and I wish you a very successful Congress. And thank you very much for inviting me to be here.
Ladies and gentlemen, Professor Catherine Pritchard-Jones. Professor, if you could kindly take your seat at the front here. Thank you very much. Let's give her a round of applause as she takes her seat. So we heard from Dr. Joyce, and Professor Catherine has also underlined the fact that Africa has its challenges, be they financial, be they the usual macro challenges. It can even be something as complex as mindsets. But what we need to do is that we must understand that we have no choice. We have to make a difference in the lives of children who have cancer. And what's been happening is that in Uganda, we have the Uganda Cancer Institute that has been working tirelessly with numerous other organizations to be able to try and make that difference. It is my great pleasure, ladies and gentlemen, to welcome the board chair, Professor Charles Olweny, to give his opening remarks. Round of applause as he makes his way.
The Honorable Chief Guest, represented here by the Permanent Secretary, Ministry of Health, Professor Catherine Pritchard-Jones, President of the International Society of Pediatric Oncology, Dr. Jonas Tegan Waldemarian, WHO representative in Uganda, members of the Board of Directors of the Uganda Cancer Institute, members of the Pediatric Oncology here present and those online, members of senior management at the Uganda Cancer Institute, invited guests, ladies and gentlemen, all protocol observed. I would like to begin my remarks by thanking the chief guest, the Permanent Secretary, Ministry of Health, representing the Minister of Health, Dr. Jane Ruth Acheng, for accepting the invitation to officiate as guest of honor at the opening ceremony for the International Society of Pediatric Oncology Africa Congress 2022. I would like to welcome members of the International Society of Pediatric Oncology who are physically present here and those online. I also wish to thank the organizing committee for preparing this conference and making sure that no stone is left unturned. Allow me to congratulate Dr. Joyce Balagadde Kambugu, the new president of the Pediatric Oncology in Africa and chair of the local organizing committee. The late Dr. Paul Carbone, who was at that time head of medicine branch at the National Cancer Institute in Bethesda, Maryland in the USA, traveled across Africa between 1965 and 1966 in search for a suitable location for a cancer center in Africa to be supported by the National Cancer Institute in the United States. He started in South Africa, then went to West Africa, then North Africa, and when he came to East Africa and visited Mulago Hospital in Kampala, Uganda, he exclaimed, "I have found what I've been looking for." He was impressed by the epidemiological study of Burkitt's lymphoma undertaken by a surgeon at Mulago, namely Dr. Dennis Burkitt, and the work of the late Professor Sebastian Chalwazi in various tumor types. The Lymphoma Treatment Center was headed by Dr. John Ziegler from the National Cancer Institute. The Lymphoma Treatment Center was funded fully by the National Cancer Institute and opened its doors in 1967 for the treatment of Burkitt's lymphoma and childhood Hodgkin's disease. The success of the Lymphoma Treatment Center led to the founding of The success of the Lymphoma Treatment Center led to the founding of the Solid Tumor Center for the management of adult tumors, namely Kaposi sarcoma, hepatocellular carcinoma, and malignant melanoma. The two units came to be known as the Uganda Cancer Institute. In 1971, an international liver cancer conference was held at Makerere Medical School, and Dr. Carbone and Dr. Ziegler during that conference convinced me to pursue an oncology fellowship program at the National Cancer Institute. My Master of Medicine M.Med dissertation was on adult Hodgkin's disease in Uganda, and Dr. Ziegler was my supervisor. I left for the National Cancer Institute in June of 1971. My fellowship embraced adult oncology and hematology program, pediatric oncology, and laboratory training. In March 1973, I received a message stating, "If you do not return now, you will find nothing to return to." Idi Amin had expelled all Indians, and many Europeans and Americans were forced to leave Uganda. On arrival, I reported to the then head of medicine, the late Professor John Kibuka Musoke, who told me that the Cancer Institute was under the Department of Surgery and asked me to report to Professor Chalwazi, who at that time was head of surgery. When I expressed my inability to head the Cancer Institute, Professor Chalwazi held my hand and said, "Son, don't you worry, I'll be there to assist and support you." He lived up to his promise, and he used to come once a week for a joint ward round with me, both at the Lymphoma Treatment Center and the Solid Tumor Center. In my new capacity, I replaced 6 American and 1 British doctor. I would do my ward rounds in the morning, and in the afternoon I would spend most of the time in the research laboratory. I eventually decided to close the laboratory and concentrated on clinical work. I also decided to engage smart medical students to assist with the clinical care, especially after office hours. The National Cancer Institute used to supply all cancer drugs and supportive care drugs to the Uganda Cancer Institute. It stopped doing so when all American doctors were forced to leave. Apart from staff shortage, lack of appropriate drugs was the next major challenge. I responded by seeking audience with His Excellency Idi Amin Dada in his office in Entebbe. At the end of our discussion, he was convinced and promised to give full support for cancer drug purchase. I received money on a quarterly basis and traveled by road to Nairobi to buy cancer and supportive care drugs. The theme of this Congress is Innovate for Africa. To me, innovation means making changes that help the society or community where we are. In this regard, I wish to share with you the concept of essential drugs in oncology, which began at the Uganda Cancer Institute. In 1975, the head of oncology at the World Health Organization headquarters in Geneva, Dr. Jan Stansford, visited the Uganda Cancer Institute. After ward rounds with him at the Lymphoma Treatment Center and the Solid Tumor Center, we had a break for tea. During the discussion, the issue of drug shortages in Uganda emerged as one of the challenges. I made a statement to Dr. Stansford: if I had only 5 drugs constantly available, I would practice good medicine anywhere in Africa. He then asked, what are these 5 drugs? In my response, I stated I needed aspirin for pain, chloroquine for malaria. Those were the days before chloroquine resistance emerged. Ferrous sulfate for anemia, because the commonest anemia globally is iron deficiency anemia. I would need one broad-spectrum antibiotic, and I would choose chloramphenicol because it has a broad spectrum and it is cheap, although I would be mindful of its potential side effects, namely aplastic anemia. I would choose one broad-spectrum antihelminthic. In response, Jan said, but you are an oncologist. Do you have a similar list for oncology? I went to my office and came back with my list of 10 drugs. He browsed through the list, folded the paper, and put it in his pocket. 2 weeks later, he called me from Geneva to say he was organizing an international workshop on essential drugs, and he wanted me to give the keynote address. I accepted the challenge and traveled to Geneva. Participants at the conference were from Argentina, Australia, Brazil, Canada, Germany, Norway, Sweden, and the United States of America. I was the only participant from Africa. After my presentation, the group of 30 participants split into 3 groups, and each came up with what they considered to be essential drugs list for oncology. The 3 groups then shared their findings at a plenary session. The final list was a replica of my list. They added only one other drug. They added only one other drug, namely cisplatinum, which was necessary for treating curable testicular cancers. I had not included cisplatinum because testicular cancers were rare in Uganda at that time. Thus, the global concept of essential drugs in oncology began at the Uganda Cancer Institute. The Uganda Cancer Institute is now a center of excellence in oncology. We have been told maybe we should change to a center of expertise. It is an autonomous institution and fully funded by the government of Uganda with support from multiple research grants. Uganda Cancer Institute stands on 3 key pillars, namely care, research, and training. A total of 36 papers were published in refereed journals last year. There are 202 students undergoing treatment in various fields in oncology, with the largest group being pediatric oncology with 15 trainees currently. The trainees are mostly from East Africa, but currently there are trainees from West and Central Africa as well. Uganda Cancer Institute infrastructure currently includes a 6-level cancer ward built by the government of Uganda, the Fred Hutchinson Cancer Center, hosting various research laboratories, and an outpatient clinic and administrative building nearing completion, funded by the African Development Bank. The Uganda Cancer Institute has regional cancer centers, with Gulu for the northern region, and construction is to be completed in 6 months. Mbale for the eastern region, Mbarara for the western region, Arua for West Nile, and in Zambia for the central region. I hope you will find time to visit the Uganda Cancer Institute headquarters on top of Mulago Hill before you return home. I thank you all for listening to me.
Ladies and gentlemen, Professor Charles Olweny, Board Chair, Uganda Cancer Institute. Big round of applause as he makes his way down. Professor, if we can kindly ask that you take a seat there at the podium too. Thank you very much. Let's give him a round of applause. All right. So what's your name?
My name is Isaiah Sosi Brandon.
Brandon. How old are you, Brandon?
I'm 8 years old.
8? But you look old. You must be like 25. Are you sure you're not 25?
Who said so?
Mom, I'm looking at your height, huh? What do you do in your spare time, Brandon?
I watch TV.
TV?
Yes.
You don't like sports?
I like
What type of sports do you like?
football.
Football, huh? What's your favorite team?
Arsenal.
Oh, I'm sorry for you. Me, I support Manchester United, but we're not doing very well either. I think we should pray for both of us. Do you want to change your team to like Liverpool? They seem to be fluking many good games. You want to change?
No.
Okay, fine. All right, so, and what school do you go to?
Kaboja.
Kaboja. All right, and what class? Let me see. You look like you're in P7.
No.
No, what class are you in?
I'm in P3.
P3?
Yes.
Wow. What do you want to do when you grow up?
I want to...
You're still thinking. You know, there's so many things you can do. You can be a president, you can be a doctor, you can be a firefighter.
I know, but I've not yet chosen what I wanted to be.
Okay. You haven't yet chosen. So I think you people have a chance to impact on his life. So I heard very concerningly that you're a bit unwell and you're being treated. Tell me what's been happening, okay? And tell me how you're feeling now.
I'm feeling okay.
You're feeling okay?
Yes.
All right. So what's been happening is that Brandon has been suffering from leukemia, but he's at the tail end of his treatment, and he, as you can see, is feeling a lot better. Let's give him a big round of applause right now. In fact, I want to give you a bonga. I said, you're a very brave young man. I want to give you a few minutes to walk onto that stage. Brandon has taken time out and prepared a wonderful poem for us. So I want you to walk up on the stage, and I want you to give us that poem. All right? Let's give him a round of applause. Brandon, that moment is yours. Right there. Stand right there. All right.
Hello. Hello, my name is Isaiah Sosi Brandon, and I'm going to recite a poem called The Littlest Soldier. The medals on our chests, a pot, a cat for maids, helmets won't stay on, 'cause no hair is on our heads. Our weapons of destruction we take every day. We fight the battle within us while we struggle on to play. We fight with honor and courage. No marine could do us well. We are only little children living in this hell. So bring out the medals, the purple hearts of war, the golden cross, the silver star, to place upon our scars. For we are the children of cancer. No one has fought so hard, but every day we struggle on. Our life is our reward. Thank you, ladies and gentlemen.
Thank you. Powerful. DJ Low. Well, there you have it. Let's give a big round of applause to Isaiah. Let's give him a standing ovation. So, Isaiah happens to be one of the children from the Uganda Child Cancer Foundation, and we've been working together with him. Come, Isaiah. You are a very powerful man. You know what? Low. You know what I'm thinking? When you are thinking about what to do in the future, okay? Why don't you also consider being a master of ceremony on the microphone, because you're very confident, huh? You want to consider that?
No.
Okay. I'm trying to impact in his life, but it's not working. All right, let's give a big round of applause to Isaiah. Thank you very much, Isaiah. The kids of these days, they don't know what's good for them, huh? All right, so ladies and gentlemen, before we call our guest of honor, it's my great pleasure now to welcome the Executive Director for the Uganda Cancer Institute. Please welcome Dr. Jackson Orem. Round of applause as he makes his way.
Our chief guest for this morning, who happens to be the Permanent Secretary, Minister of Health, standing in for the Minister of Health. The Permanent Secretary is Dr. Diana Atwine, and the Minister of Health is Dr. Jane Ruth Acheng. The Director General of Health Services, Dr. Henry Mebesa. The WHO representative to Uganda, Dr. Yona Stegen. The Chair of the Board of the Uganda Cancer Institute, Professor Charles Olweny. The President of SIOP, Professor Catherine Pritchard-Jones. Ladies and gentlemen, in your different capacity, allow me to say all protocol observed. I want to take this opportunity to welcome you to Uganda in a special way. It is really an honor that even within a very short notice, when this conference was transformed from being 100% virtual to being mainly in person and some segment being virtual, to see such a large number of delegates coming to Kampala. This to me is a vote of confidence that you have in our country, and perhaps also in the measures that we have taken in the fight against the deadly COVID. To see all of you here, to me, is a big endorsement of the safety and all the other measures that our government has put in place. So a round of applause to our government. Allow me to go straight to what really I want to say. Listening to the presentation that has been going on over the last few days and also this morning, one cannot really stop at just thinking of what is going on in as far as the field of pediatric care is concerned in Africa for those children who are suffering from cancer. Of course, Professor Charles Olwenya has already given a very good background to the initiatives that has been taking place ever since in the field in Africa. Of course, he talked about the establishment of the Uganda Cancer Institute way back in the 60s. That came about as a result of international collaboration as well as focus on children. So when you hear the presentations, it looks like Africa tend to be just going in circles and not kind of making progress. And I think, to me, that is something which needs to be changed. Because there have been initiatives in the past. You can say, starting from the 60s, the Uganda Cancer Institute was established precisely as a research institute for childhood cancer. Because at that time, in 1958, a new cancer was discovered here called Burkitt's lymphoma. And that cancer actually turned out to be of great premise in as far as research into cancer care is concerned. I can say that a lot has been done in as far as Burkitt's lymphoma is concerned. Up to today, there is no single world-class laboratory in the world that does great science without having the bedrock of the scientific initiatives that were done here at the Uganda Cancer Institute and of course in other African countries, be it in Ghana, be it in Nigeria. All those days actually the focus of science was on that new cancer that was prevalent in Africa. So one asks himself or herself, why is it that every time Africa is still being thrown at the back when actually Africa was at the front in as far as research is concerned, in as far as the development of treatment of childhood cancers was concerned. Professor didn't go to talk about the initiatives in the treatment of cancer, for instance, the development of combination chemotherapy. In the 60s, actually, cancer treatment was still mainly a research endeavor. And most of those researches in terms of the combination chemotherapy, how they can be provided, were actually done here in Africa at the Uganda Cancer Institute, and by extension also to centers in Ghana and Nigeria. So we can say that actually Africa has been at the forefront of initiatives for treatment of cancer in the world. So to see that we are actually at the back at this point, to me I think it is showing that Africa is going round in a cycle. The second point that I want actually to bring out is the consistent achievement that the Uganda Cancer Institute has made ever since. Professor Olwenya talked about the dark days of Idi Amin, as well as in the 80s when actually we had a lot of turmoil in our country, and then of course the coming of HIV. All those aspects actually impacted on the operations of the Uganda Cancer Institute. But one thing that I can say is that we as a country have never lost focus of management of cancers in children, and up to now our children are being treated at the Institute, and it has always been actually a focus of our endeavor. So we want to be part and parcel of what is going on, and we want to mobilize within Africa what we are doing. We don't want to have those segmented ways of doing things. The progress that has been made ever since those early days, we need to see them being brought on board We need to see them being recognized. And in this aspect, actually, at this conference, we have a very powerful book that has been written on the history of all these endeavors, starting here at the Uganda Cancer Institute, and also highlighting some of the other aspects that has been going on in other parts of Africa. It would be really a great pleasure for each of you to get hold of a brand new book called Africanizing Oncology. And the author is here. I hope she'll get time to launch her book. Marisa Micah actually has written a fantastic book that can show you the potential of innovation that Africa has. And I think if we can add this to the emphasis that SIOP is making, I think it will make Africa leap instead of Africa restarting every time there is a new initiative. Lastly, let me share with you some of the achievements that the Uganda Cancer Institute has made in terms of being at the forefront of the implementation of our National Cancer Control Plan. And in this, I want also to applaud our government for actually thinking outside of the box. With the plethora of other conditions, including infectious diseases and all these other things that make, in most cases, our government to forget focus on other emerging problems like cancer situation, our government decided to establish a fully fledged government agency to look at only one thing, and that is cancer. And that is the Uganda Cancer Institute, established by an act of parliament in 2016. And its focus is to make sure that there is full implementation of our National Cancer Control Plan. And I think there are very few countries in Africa that is doing that. Secondly, our government has made sure that actually the issue of access to medicine is dealt with. And this it has done in a very innovative way as well, by ensuring that the Uganda Cancer Institute deals directly with manufacturers of drugs. And today, I can assure you, our access to essential anti-cancers and also including some rare elements now stands at 85%. And this is actually in excess of what WHO recommends. WHO recommends actually that our target should be at 80%. Uganda has now achieved 85%. And this is something which can also be emulated by other countries. Thirdly, we are decentralizing our services by the creation of what we call regional cancer centers. We don't want people to travel far to come and access care, and we are building these regional cancer centers, and the professor has already talked about. We want access to all cancer services to be closer to the population. Fourthly, the Uganda Cancer Institute is also helping the East African Community member states to develop standards and also to improve on care through the East Africa Center of Excellence in Oncology, which is here at the Uganda Cancer Institute. And I'm proud to say that pediatric oncology is at the forefront of the implementation of the agenda of the East Africa Center of Excellence. We have created fellowship programs for pediatric oncology. Next, we are also going to actually have nurses and all the others. Finally, in terms of quality of service, the Uganda Cancer Institute ensures that our practices are harmonized, as well as having guidelines and following those guidelines and making sure that practitioners actually toe the line in as far as providing care is concerned. That means that actually there is uniformity of the way we do things. There are many other things that can be learned out of what is being done at the Uganda Cancer Institute, and we want to be part and parcel of the GICC initiative because there is already a lot that we can share with the rest of Africa. And that said, I would want to end here by once again thanking you all and for the many initiatives that is going to be shared in this conference. And I hope at the end of the day, Africa is not going to again move in a circle. Thank you.
Ladies and gentlemen, Dr. Jackson Orem, Executive Director for Uganda Cancer Institute. Let's give him a round of applause. Ladies and gentlemen, And our final speaker before we call our guest of honor, please welcome with me the World Health Organization country representative for Uganda, Dr. Jonas Waldemariam.
Thank you. The guest of honor, Dr. Diana Twinney, the Permanent Secretary of Ministry of Health, representing the Honorable Minister. Thank you for being with us and for your great leaderships of this country's health sector. Honorable members of Parliament here, because I know that Uganda Parliament is one of the most committed in addressing cancer in this country and could be an example for other countries. The Director General of Health Services, Dr. Henry, for providing us technical leaderships in this area and your great collaboration with all the partners. Professor Charles Oluweni, thanks for being here. When I realized a colleague of mine told me a bit about you, I realized I'm standing with a giant. Thank you for your contribution. Dr. Jackson, for your leaderships of one of Africa's great health institutes and keeping it in the direction of serving Africa at large. Professor Catherine, I think no words would say that you managed to make this institute, this scientific group of pediatric oncology come to Uganda and for helping our African chapter to grow. Thank you for being here. Dr. Joyce, my apologies. In Ethiopia, when we respect people, we call them by their first names, and by now you should be very well versed with this. So, Dr. Joyce, the African SIOP president, for taking this mammoth task at a very difficult time. Probably a few months ago, if somebody says that you would organize this, you would say, maybe only virtual. But you made it, and thank you for that. Distinguished scientists, our guests from all over the world, and to spare myself from the embarrassment of that I might have forgotten some of you, all protocols observed, ladies and gentlemen. I congratulate the officials of SIOP and the organizers for really a successful scientific conference. I am happy, humbled, and honored to attend this international conference on pediatric oncology, African Congress, with a theme which couldn't have been any better, Innovate for Africa, that will update us on the best practices and innovations for averting preventable childhood mortality due to cancer. Worldwide, cancer is becoming one of the leading causes of death for children and adolescents between the age of 0 to 19 years, accounting to over 400,000 deaths annually. 400,000 kids and teenagers. That's too much. Even one child loss of preventable disease is acceptable not acceptable for any of us. Over 28,000 children die from cancer in sub-Saharan Africa during even this COVID-19 pandemic in 2020, according to the report of WHO 2021. An estimated 2,834 new cancer cases were diagnosed among children aged between 10 and 14 years in Uganda in 2020. This, we believe, is an underestimate since the Lancet study, which showed us that we have a proper cancer registry in a very few countries in the sub-Saharan Africa. Lymphomas, nymphoblastomas, copsisarcomas, retinoblastomas are the most common pediatric tumors in Africa. Although most children cancers have high cure rates of up to 80%, only 20 to 30% of children in cancer in low and middle income countries survive compared to over 80% in high income countries. Just like what we saw in vaccine access, here also in cancer we see a very dark red map which is showing us the inequity in the world. And this gathering should enable us to innovate and make change. In Uganda, most children with cancer have a less than 60% 3-year survival rate apart from Hodgkin's lymphoma. Although Uganda is one of the best achievers in survival and giving services. A low survival rate for childhood cancers is due to inadequate capacity of health system compounded by profound lack of awareness by the affected people, leading to a late diagnosis and treatment. Only 29% of low and middle income countries have adequate level and range of access to cancer medicines compared to 96% in high income countries. As you are already aware, in response to the World Health Assembly resolution on cancer control through an integrated approach, WHO, in collaboration with St. Jude Children's Research Hospital, launched the Global Initiative for Childhood Cancer in 2018 with a target of at least 60% survival of all children with cancer by 2030. This initiative requires a doubling cure rate to save 1 million more lives. Allow me to mention some of the WHO tools for childhood cancers. The Cure All framework and technical package for implementation of the initiative. The information sharing portal to facilitate sharing of expertise between countries and partners. The first global platform for access to childhood cancer medicines based on best care standards that was launched in 2021 in collaboration with St. Jude Children's Research Hospital. WHO and the International Agency for Research and Cancer, IRAC, collaborated with the International Atomic Energy Agency and other UN organizations and partners to develop standards and tools to guide the planning, implementation, and interventions, including early diagnosis, treatment, palliative care, survivorship care, and access to essential medicine and technology. WHO is committed to provide technical support to governments and partners to reduce the inequity in childhood cancer diagnosis and treatments, and hence to contributing to the progress towards the achievement of the Sustainable Development Goals, specifically 3.4, which namely says that reducing preventable mortality due to non-communicable disease by 1/3 by 2030, and target 3.8 on universal health coverage, including financial risk protection, access to quality essential health care, and access to safe and effective quality of affordable essential medicine. I have an ask for all of you, especially those of us coming from countries in the sub-Saharan Africa. The first ask is, let's make sure we have the information, which is reliable, because that is important to guide our plannings and activities. Such information is important to our politicians because it's reliable, accurate information which would make a change in decision making. Let's make sure we have adequate human resources in our countries. Let's make sure we have a comprehensive cancer control strategy and plans to lead us in this direction. Instead of having scattered services, probably having centralized services might be a way to start, as we can see in Uganda, that was able to push the drive nationally. Let's lobby our parliamentarians, decision makers, and governments for adequate funding and ensuring there is a multi-sectoral action with all partners on board. And let's also focus on prevention, early diagnosis, and also addressing the environmental factors. In conclusion, allow me to emphasize that high-quality epidemiological data is central to improving cancer care, and therefore robust childhood cancer data systems are fundamental for driving continuous improvement in the quality of care and evidence-based policy decisions. I thank the Uganda Cancer Institute, the National and International Pediatric Oncology Chapter, distinguished scientists, everybody who has made it possible for us to reflect on how we can fast-track implementation of the initiative to reduce preventable mortality and morbidity to childhood cancers. Let me take this opportunity to remind you that although we are having fewer and fewer COVID cases, we are not out of the woods, and we need to follow the public health measures for preventing transmissions. I hope all of you are vaccinated and boosted. If not, make sure you are vaccinated and boosted. I also urge you to take the opportunity of coming to Uganda for our visitors to visit this beautiful pearl of Africa. I thank you.
Ladies and gentlemen, Dr. Jonas Woldemariam, WHO Country Representative. Thank you very much, Doctor. It's my great pleasure now to ask Dr. Jackson Orem to come back to the podium to introduce our guest of honor. Let's give him a round of applause.
Thank you. Once again, it is my great honor and privilege. I take it as an opportunity, and I want to break protocol and skip Dr. Henry Mebesa so that the honor is on me to invite our chief guest this morning. Our chief guest this morning, as I stated earlier, is the Permanent Secretary, Ministry of Health, Dr. Diana Atwine, who is standing in for the Minister of Health. Dr. Diana Atwine is a very passionate, strong advocate, professional, name it, in as far as the health sector is concerned. She knows the sector in and out. She is an hands-on administrator, somebody who always goes and is at the spot. I was really humbled to get her to come and officiate at this conference at a very short notice. So I can go on and on and on, but it is really my privilege and honor this morning to invite Dr. Diana to come and make her speech.
The Director General of Health Services, Dr. Henry Mwebesa, the country representative of World Health Organization, the representatives of World Health Organization from the region, the President, SIOP International, Professor Catherine Jones, whom I'm really excited to meet because I've heard about you and this is my opportunity to meet you. The President-elect, SIOP International, the Chair of the Board and one of our icon in our country that we take pride in having, Professor Olwen. I believe in his keynote address, you've been able to know the contribution he has made in this country. The Executive Director, Uganda Cancer Institute, the President of CCI Africa, the President, COP Africa, the survivors of cancer and the parents and the guardians of the survivors, the senior officials from Ministry of Health and the oncologists in the country and abroad, dear distinguished delegates from Africa and abroad, outside Africa, the development partners, in the interest of time, ladies and gentlemen, I observe the protocol. It is my great honor to stand here before you to open this 14th African Continental Congress of the International Society of Pediatric Oncology. I bring greetings from my minister, who was assigned the duty abruptly and she had to travel, and so she could not be here with us. But I want to tell you she's here in the spirit. She left, but her heart was here. And so I bring her greetings and apologies. Before I read her speech, I just wanted to make a few remarks as the Permanent Secretary of Ministry of Health. As a physician, as once a clinician, and who knows what it takes to take care of cancer patients. First of all, I want to thank you for the theme of this conference, how Africa can innovate to do things a little different to achieve our targets within the circumstances that we operate, within the resources that are at our hands, and within the context of other disease burdens that compete with the cancers in our country. How do we innovate to improve access to care? You have heard that in middle income and low income countries, the survival rate stands at 20%, while at high income stands at 80%. That means if we are going to get to our target of above 60, as we stand in our respective capacities from our countries, that we have a duty to innovate. Innovation means you think out of the box in order to deliver within what you have. Innovate means you are going to start thinking differently, and approaches must be different. A lot of research has been done in Africa, and in Uganda in particular. You have heard Professor Lwen take us through the journey of cancer care in Uganda and in Africa. A lot of publications have been made, and we continue to do publications and more research. But we want to see Africa take another level of research, own research, implement the findings of the research. We want to see go higher in our implementation, that we improve the issue of governance. And I was very glad when Dr. Sharon, when she was here, she really talked about governance. Governance, it is not just the structure. Governance is about implementing the policies that are actually going to transform, to implement the policies and the regulations and the protocols that are going to get us there. As I stand here, I want to commit, and I was excited to have opportunity to meet the team led by Catherine yesterday, and we discussed more on how we can be part of this global initiative that has stepped out to enhance care of childhood cancers. And I want to commit on behalf of government of Uganda and on behalf of Ministry of Health that we are going to put structures that will accelerate us to get to that level where we want. And I'm glad when I was chatting with the executive director, because I had not had opportunity to look at the statistics in the country on childhood cancers, I want to report to you that our survival rate in the country is at about 50%, which is slightly above than the average of the middle income or sub-Saharan statistics. But we still have a long way to go, because even 60 is not sufficient enough. 60 is simply barely the minimum we should target to. But we need to get to 80%. If the other countries can do it, it is very possible that we can do it. And therefore, we have a big task at our hands when we talk about Africa innovative way of getting to 80%, because no child should die of cancer in this era and age. When we know what to do and how to do it, we know that we still struggle with financing. We need to leverage financing and take advantage of the partnerships that are existing. Yesterday, I was so excited to hear about the work of St. Jude and what they are doing on the continent. We need to leverage and enhance those partnerships, true partnerships, because sometimes we have seen partnerships that come and they are skewed to certain areas, and you find that it's not a mutual partnership, but it is skewed to meet certain targets of the funders. But here we are talking about real, true partnerships that are mutual, and we stand together. If we do research together and we are recognized together. If we bring resources, we put it to the real need, and those resources to make the difference in the lives and the survival of our children. Therefore, I want to say for me, on my behalf and on behalf of our Ministry of Health, we are excited to host you here. But most importantly, we are excited to see the mood, the commitment, the zeal. I was looking through the papers that are going to be presented, that have been presented in this room. I participated on Monday on retinoblastoma meeting in Munyonyo, and I heard the papers that were presented. And I was excited, because the mood is that we can do it. The mood is that we shall do it. The mood is that we are able to do it. And we can put in place the mechanisms that help each nation, especially the low-income countries, to get up to our feet and run. It is very possible. And I'm very, very excited to be here and be part of this meeting. Allow me quickly to read through the speech of the minister. It is a great honor to preside over the opening of the 14th African Continent Congress of the International Society of Pediatric Oncology. This much anticipated meeting has brought together members in Africa and international community to discuss the critical matter, which is, what must Africa do to increase the survival of our children that have cancer? I am aware that this Congress was to be held last year in January 2021, but due to COVID pandemic, which caused unprecedented worldwide paralysis, this did not take place. Nevertheless, the fact that Uganda has honored her promise to convene this meeting indicates the seriousness we attach to this matter. Each year, as you heard from WR, 429,000 children and adolescents worldwide develop cancer, and of these, 80% live in low and middle income countries. Almost 40% in Africa. That is a big number. Survival in low and middle income countries include much of Africa is less than 30%. Yet we know that survival rates as high as 80% are achievable. Even my minister believes that it is achievable. Colleagues in high-income countries have achieved it. Why not us? As Africa gets better of infection-related mortality, cancer is emerging as a leading cause of mortality in this age group, and we must rise and do something about this. Fortunately, the causes of poor survival are surmountable, including treatment. Unfortunately, the causes of survival are surmountable, including treatment, abandonment, as you heard in the morning in the presentation by Dr. Sharon, misdiagnosis or failure to diagnose at all, late diagnosis, among others, as have been mentioned by the previous speakers. The World Health Organization launched a global initiative of childhood cancer in 2018 with a target of 60% childhood cancer survival globally by the year 2030. As we know that better survival can be achieved through our hands. The Congress theme, Innovate for Africa, challenges us all to find innovative ways to improve survival of children with cancer in Africa, despite the resource constraints that are prevalent in our countries. The government of Uganda has been and is still committed to ensuring that all patients, in particular children and adolescents with cancer, receive the highest quality of cancer care. We are not yet there today, but we'll get there step by step. And I will not go through the things that so far government has done, because I think the executive director mentioned them all. One of them is enactment of the law to make sure that we give full autonomy the Cancer Institute to make decisions and resource for financing so that they are able to fly, to spread out their wings without any limitations. And that one, we have done it. And thus, I want to tell you that it is one of the reasons why Cancer Institute has been able to even increase access to care, to increase the availability of medicines, because they are now free to really look for resources without any hindrances. Because you know, in government, if you are going to look for resources under our mainstream, their processes are so long. But I am glad that you are able to fly with your wings spread out with no limitations. He talked about access of medicines. The access to care has greatly over years improved. And we can't say we are at 100%, but I want to say that we are much better than how we were 5 years ago. And thank you so much, the management of Cancer Institute, for this effort, for continuously improving the care of our people in the country. I want also to say that we have developed the National Cancer Control Plan. And this cancer control plan is detailed that if it is implemented, it will take us there. It will take us where we want to be. And I want to thank the teams that put together this control plan, and we are now ready to run with it, especially if we gain full access to work with global initiative for childhood cancer. We have seen over time improved the diagnostic and care through radiotherapy services. We have improved infrastructure, and we continue to improve. As you heard, we are expanding the access to care so that people don't travel long distances by opening up more regional centers. And we continue building capacity of our human resource, because I want to tell you that even if you have infrastructure, without a human resource, you'll be dancing in the darkness. So our priority is also continuously training and increase the oncologists and on all other support specialists to make sure that not only in the center here in Kampala, but also in the region. And this is our target, and we have already worked out a training plan in the last 10 years that will see us get quite a big number of oncologists in the country. Lastly, I wish also to take this opportunity to thank our development partners, including, among others, the International Atomic Energy Agency, Fred Hutchinson Cancer Research Center, St. Jude Children's Research Hospital, MCC Global Hope, Cambridge University, and the civil society partners, both local and international, for tremendous support towards the increasing access of care in our country. Ladies and gentlemen, we are aware that ongoing COVID pandemic has posed great challenges to meetings such as this one. But we want to thank you for braving to come to Uganda, especially those who are coming from outside Africa. I know that stories sometimes scare, but we want to thank you so much for coming, and want to appreciate those that online that made tremendous and wonderful presentations that enriched our conference. I would like to thank all delegates that traveled to come to our beautiful country, the Pearl of Africa. Enjoy the weather. I know, although we are putting AC, sometimes we don't need AC. God gave us the natural AC, where you don't need to heat the air or you don't need to cool the air. Just relax and enjoy the good weather. I conclude, let me salute visionary team behind organizing this wonderful conference. Dr. Balagade, thank you so much, and your team, an entire Cancer Institute team led by Executive Director, and the board. We want to thank you, the board, for the great work you are doing. You are making us proud. Professor Wayne, he's a modest, he stood here, yes, he was modest, but he's one of those people we are so proud about. And we just pray that God will continue giving you good health, that we continue receiving wisdom and counsel as we improve the care of this country. Thank you so much, and have a great day, and wish this meeting opened. Thank you very much.
Thank you very much, Dr. Diana Twine, our guest of honor, the Permanent Secretary, Ministry of Health. Doctor, before you sit, in fact, you have done your duty. We'd just like to do pictures at the front. So could I ask all the guests to stand at the front? Members of the photography team, could you kindly prepare yourselves?